Welcome, everyone, and thank you for joining us this afternoon. My name is Leslie McCall, and I'm the Executive Director at the American Heart Association in Oregon and Southwest Washington. The American Heart Association and Regence Blue Cross Blue Shield of Oregon have joined forces with the goal to empower everyone to be able to make a plan for their care in case of an emergency. A couple of housekeeping items before we begin. Today's discussion is a webinar format, and even though we can't see you, we want to hear from you. So we'll have time at the end of the program for your questions, and we'll have answers. So please put your questions in the chat box. Make sure to choose all panelists and attendees from the drop-down menu. And it is now my pleasure to introduce our moderator for today, Leslie Foran, Assistant Director, Personal Care Support with Regence. Welcome, Leslie.
Thanks, Leslie, and good afternoon to everyone who's joining us for this important conversation. I'd like to start out by thanking my team at Regence Blue Cross Blue Shield and the American Heart Association and all of our speakers today for the event we're going to be putting on. We're excited to bring this virtual conversation about making your plan, the importance of designating a healthcare proxy with you today. You will learn a couple of things in today's webinar. You'll understand why it's important to have these discussions about your cares and preferences and wishes and learn how to designate a healthcare proxy. Before we begin, I want to share what a healthcare proxy is. It's also referred to as a healthcare agent, a power of attorney, or surrogate. A healthcare proxy is someone who speaks on your behalf when you can't make your own healthcare decisions. And I also want to add, as we make our plan, it's important, you may also hear the words advanced care planning, which is really a process for planning for what future healthcare needs you may have. And so please feel free to chime in, as Leslie said, in the chat and ask questions that if we use an acronym or we use a term that you're not familiar with, we want to help you understand the importance of all these different words you might be hearing and provide any clarity if you have any confusion. In today's webinar, you're going to be hearing from the patient, caregiver, and physician perspectives about this important topic. Joining me first is Dr. Emmanuel Tavin, a pulmonologist and ICU director at Legacy Mount Hood Medical Center. Welcome, Dr. Tavin.
Good afternoon.
Great.
First off, I want to thank you for having me with you this afternoon to talk about this very important topic. It wasn't until I was asked to actually participate that I realized the extent of how important having a healthcare proxy, how important it is in my day-to-day work at the hospital and in clinic. So I want to thank you for that because it just made me realize how important it is and how important it is for patients and families to be aware of this.
Well, we appreciate you taking the time out of your busy schedule to be here with us today and to share your perspective. I know, because we've had some previous conversations in preparation for this webinar, that you spend half of your time in the acute care setting, in a clinic setting, and then half your time or some of part of your other time in the ICU unit at Mount Hood. And can you just kick us off and share, just in those two environments, in those two clinical settings, how you have seen a healthcare proxy play out? What does that look like in both of those settings?
Yeah, so in terms of my day-to-day work, as you mentioned, I wear different hats around the hospital, and I've realized how having a healthcare proxy is important in any settings that patients might encounter. In clinic, I take care of patients with pulmonary problems, but I often have patients who present with a family member and at baseline are not able to make complicated healthcare decisions. I'm talking about patients with advanced dementia, patients with prior strokes, patients with psychiatric disorders. And having a healthcare proxy in that setting is very important. There's a lot of communication that happens in that half an hour to an hour where I'm sitting down with patients in clinic, and someone is going to have to help once the patient leaves the office because I won't be there. Someone is going to have to help with the new prescriptions, following directions, scheduling tests, and so on. And then the other part of my job is working in the hospital, and I work in a setting where patients are often not able to make decisions. In the intensive care units, the majority of our patients are either on life support or have an illness that is so severe, it is clouding the patient's judgment and making life or death decisions is something that is very difficult if you have any kind of impairment. And so I deal with those two situations on a daily basis. And I'm often reminded how important it is for patients to have someone that they can rely and count on to help them make decisions like those. We have to remember that in the hospital, especially, consent for procedures is paramount to what we do. I need someone to agree to any type of procedure, including very benign procedures. And if patients are not able to make those decisions themselves, I have to rely on someone else to make the decisions for them.
Right. I think you bring up a really good point about the role of the caregiver in all of this is that the caregiver has a lot of responsibilities. You mentioned making appointments, filling prescriptions, scheduling additional, follow-up specialty appointments, those types of things. And sometimes the healthcare proxy is really there, just so I'm clear on this. The healthcare proxy is really there to make healthcare decisions should the patient or the individual be unable to speak for themselves due to an acute situation, a car accident, something that's happened and put them in the ICU, or if they have a diagnosis that dementia, something that they're not able to care and make those sound decisions for themselves. Is that correct? That the healthcare proxy is really around the healthcare decisions. It may be the same person who is also serving in that caregiver role, but it may be somebody else.
Absolutely. Yeah. I mean, in the outpatient setting, just discussing, for instance, a lung biopsy, a patient who's not able to make that decisions for themselves, there is a lot of risk and benefits to consider in proceeding with that procedure, with such a procedure. And it's really up to the healthcare proxy at that point to make the decision. And those decisions are made on a day-to-day basis, whether we're considering someone who's at home as an outpatient or someone who's in the hospital, severely critically ill in the ICU.
Mm-hmm. So you've talked about how important it is to have this person designated, but can you discuss how, and you talked a little bit about the consent and maybe dig into that a little bit more about how, when you see someone in the ICU and you discover they do or they don't have a healthcare proxy, how does that affect the team or you or your team's ability to deliver care at that moment?
So finding a healthcare proxy can be very time consuming, time that I may or may not have available. I treat patients that are very sick. Having a designated person that I can go to consent for procedures means I can start the procedure earlier. Delays in getting consent can lead to delays in care. And what a lot of people don't realize, it is the physician that makes the phone call. If I have to make 5 phone calls to find someone to consent for a procedure, that's a lot of time, that's a lot of delay in patient care. Having that designated person, whether it comes in the form of a paperwork that the patient came in with, or something that is documented in their healthcare records, cuts down on that delay that it takes me to start a procedure and take care of patients. So that's why I always advocate for patients to have those discussions early on, have that designated person identified clearly, and for that person to also know what the wishes are. Sometimes I will call a family member who is the appointed healthcare proxy, but there's a lot of back and forth because we're not clear on where to go, or would someone want all the procedures that we have to offer, or are there some limitations that have been predetermined? So it's important for the healthcare proxy to be readily available, but it's also important for that healthcare proxy to know what the wishes of the patients are, so that there is no delay in care when it's time to do procedures or move forward with treatment.
So really, this healthcare proxy is really about kind of, designating somebody and then documenting it and making sure that it's written down either in an advanced directive document, a living will, or in the electronic medical record, that there is documentation that says, I, Leslie, give, this person, if I'm unable to speak on my behalf, this would be my healthcare proxy. And then you then can see that documentation and know that that person is really speaking on their behalf. And so you're really looking for not word of mouth, not, I'm the person, or the daughter comes in and says, no, I'm the person. You're really looking for a hard copy, if you will, or documentation of proof that this is the healthcare proxy person. And then can you talk a little bit, you mentioned, making a plan and having that conversation. As a pulmonologist who's working with a population of patients who are sick and have life-limiting illness and can maybe live a long time and have good quality of life for a long time, but something could happen at any moment's time and their care could change, the plan could change. How you approach working with your patients about identifying a healthcare proxy, maybe things for them to consider about qualities for someone that they're considering asking, or how does that process, how do you prepare that conversation with your patients and their families or friends?
Yeah, that's a very good question. When selecting someone as a healthcare proxy, I would say some of the qualities that are important would be, first, they have to be willing to take on that role. It is a huge responsibility, because you may be asked to make decisions that are about life and or death. One thing that's very important for a healthcare proxy is to be able to separate what they would want for themselves from what the patient wants for themselves. And I always try to emphasize that when we're making those decisions in the ICU. I always mention that this is not about what we want for ourselves right now. This is what does the patient want? And putting those emotions and those feelings aside is very important, because when you're dealing with a loved one who's struggling, it's easy to get distracted and lost in the emotions. And so that's one of the key quality that I would identify for healthcare proxy, is to be cool, calm, and collected like we are, because we are going to be making some decisions based on the available medical facts at the time. A healthcare proxy needs to be available and invested. It's not uncommon for me to make multiple phone calls throughout the day and the night to discuss procedures, get consent. And so there is going to be an investment of time as far as when you're kind of called into action. But we do offer quite a bit of support. Healthcare proxies they're not on their own, kind of making these really tough decisions. They have an entire healthcare team working with them to help them make those decisions. They just need to be available. So while you can pick a healthcare proxy who lives across the country, it's going to be a little bit more difficult for us because of time difference and location, geographical differences. But if that's all you have as a family member who's willing, who knows you well and knows what you want, that's okay too.
So we don't all have to have a nephew who's a physician or a cousin who's a nurse who has to, somebody who's a clinician to step into this role. It's really about somebody who has that competence to stand in on your behalf and then to speak up and kind of be objective, put their wishes, their concerns aside and really represent you. They have to have the time because potentially this could be a 24/7 responsibility for a time being. And then they have to have that stability and be able to work with a team, be able to, take direction, give direction, those kinds of things. As a follow-up, you mentioned someone being a healthcare proxy could be across the country. Do they have to be in the same state that I would reside in, or as you're doing a healthcare proxy, or is it more just that availability and being accessible by phone or text or video call? How does that work?
I mean, so technology's changed things quite a bit in the last 20 years that I've been doing this. It's fairly easy for me to get in touch with someone who's across the country in a different state. And so we don't have the same barriers that we used to deal with. And most hospitals now are set up with an iPad that allows for a video call with the physician, between the physician and the healthcare proxy, but also the healthcare proxy and the patient, should they need to talk about what's going on. And so those geographical barriers are not as significant. I always prefer to have a family member or a appointed healthcare proxy at the bedside. I think that's always very helpful, but it's not a requirement.
Okay. And I know as we've just, come out of COVID-19 and the pandemic, and we saw a lot of folks that were sick and unable to respond or give direction about their care, and read and heard stories about the iPad at the bedside and making, family members weren't allowed into the hospital. Can you share the process if someone doesn't have a healthcare proxy and in an emergency? How does that process go of identifying a proxy when they don't have one already? How does your team respond, and what are the kind of the protocol for that type of thing?
That's another very, very good question. And that's because we kind of differentiate the two types of healthcare proxies. You have the healthcare proxies that have been appointed ahead of time, identified ahead of time, whether it's in the chart or with a legal document. And I always recommend that approach because if there isn't someone who's appointed as a healthcare proxy, we go from a list that is essentially a default healthcare proxy. And that list is established by the state laws, and they're different depending on the state you live in. The issue with going with a default healthcare proxy is whoever is going to be the default proxy may not know your wishes. They may not be familiar with your healthcare issues. They may not be the first person that you would want making decisions for you. For instance, if you have a son who you haven't talked to in 20 years, who lives across the country, but you live with a significant other and you've been with that person for the last 30 years, but you're not married and you have not appointed that significant other as your healthcare proxy, I have to rely on the son who you haven't talked to for the last 20 years to make decisions for you, because that's what the law tells me is the next of kin, the person that is lawfully able to make decisions for you. And so it does get tricky. It does get messy at times. We sometimes have people that are next in line as the next of kin not willing to make decisions, and now have to go down the list. And it is something that's very time consuming. I'd rather spend that time at the bedside. I often have to make multiple phone calls to find someone who's willing to help make decisions. And that's time that I'd rather spend taking care of the patient.
Mm-hmm. Absolutely. And I see that the American Heart Association's put a link in the chat about the default next of kin when there's no appointed proxy in the chat for folks to check out to see how that works here in Oregon. So thank you so much, Dr. Tavin. We are going to have you join us in a little bit for the Q&A session. So folks, if you have questions specific for Dr. Tavin, please put them in the chat. But next, I'd like to introduce two special guests, Jill Vigiano and April Frezza. Jill, they're going to be presenting the caregiver and patient perspective. Jill has spent 19 years working in commercial real estate before retiring to become a full-time mom. When her husband survived a massive stroke in 2008, she focused her skills on his recovery. Jill wrote a book about her spouse and caregiving experience, shedding light on the real-life impact of acquired brain injury and providing hope and encouragement to those facing significant challenges. And just 2 weeks after her 50th birthday, April Frezza collapsed due to a cardiac event while riding her bicycle. Luckily, a retired sheriff's deputy was driving by and was able to perform hands-only CPR until paramedics arrived. Jill and April, I'd like to welcome you both to the conversation.
Thanks for having me.
Wonderful. Thank you both for joining. Jill, I'm going to go ahead and start with you. You have been a caregiver for you have multitasking. I love it. You have been a caregiver for 13 years for your husband. And I'd like to just kind of start out, if you'd be willing to share your journey with us and kind of what happened and how your journey as a caregiver has evolved over the past 13 years.
Sure. So it was Gordon, my husband Gordon's 51st birthday. No risk factors, healthy, active guy, still managed to suffer a massive stroke that night. So it turned out he had a spontaneous bilateral carotid artery dissection, resulting in a massive stroke. He lost the right side of his body, his ability to speak, his memory, and his ability to organize his thoughts. His cognition was messed up. So from one day celebrating a birthday to the next morning, having a serious conversation with an organ donation person, it's certainly not what one thinks of at that stage in life. And so we just dove into recovery. You hear a lot of people say you have 1 year to recover, you have 2 years to recover. We were fortunate to have our neurosurgeon said, those who want it most recover best. Well, we took that to heart. We threw off any kind of limitations, and we just went after recovery as hard as we could. I'm happy to say that 13 years later, he walks, he talks, he still has some deficits, but really he's recovered far more than anyone thought was possible.
That's amazing. And it sounds like your resiliency, your mindset as the, kind of the initial shock of my life has just completely changed in a matter of moments. That determination of, we're not going to listen to anything with limitation, that we're going to continue to persist and pursue along the way. Can you talk a little bit about that resiliency as a caregiver and your kids? Who and how were your supports during that time?
Yeah, there weren't a whole lot of supports. I mean, I shouldn't say that. My community was incredibly helpful, but really when you dig down and you have to get down to the work, there's no substitute. There's no one that's going to do it for you. We did have an incredibly supportive community, and people really rose to the occasion. I'm always so thankful for the people that were in our lives. But really every day we had a plan. We made plans. I made plans. We had a calendar that we followed. We just had to take it on as the biggest challenge of our lives. We knew that if the only reason you wouldn't recover is if you stopped trying to recover. Now you may not get it all back, and we didn't, but because we were never willing to stop trying, we got far more than we were ever thinking we were going to. And I would say we saw recovery for probably somewhere between 8 and 10 years. So
Wow.
One, it gives great hope. And the flip side of that is it took 8 years for him to open his hand. It took 8 years to be able to open all 5 fingers on one hand. So this didn't come easily. This came with hard work, but it's possible.
Right. The power of hope is really powerful.
Yes, yes. And I always say recovery is a team sport. You have to have a cheerleader, at least a few. You've got to have a coach. You got to have people on your team. No one recovers alone.
Right. Absolutely. So I want to go back to, we've been talking with Dr. Tavant, about making the plan, and how important, sometimes, things are coming, life events are coming, you're preparing for a surgery. Other times things happen like this and your life completely changes. You have an acute incident or accident or something. So can you share if you and Gordon had already had a healthcare proxy identified? It sounds like you stepped in. But did you already have documentation or how was your the situation impacted by having a healthcare proxy or not having one?
When we had kids, we thought, well, we need to have our legal documents in place. We needed to have a will, because if anything happened to us, what would happen to kids? So our estate attorney, thankfully, really brought us through all of those documents. So we had all those documents in place. And I consider it kind of like legal documents for dummies. He put them all in a binder with tabs that says will, health proxy, power of attorney. So there's no question, even people like me could follow where my legal documents were. So we had all of that in place. And that was extremely helpful, especially, when they're talking about, what are we going to do with his organs? Because Gordon and I had gone through that process of having those documents made, we had already had all these discussions. So we had no anticipation of something so horrible happening so young. We're so optimistic. We think bad things only happen when we're old. But we had all those discussions when we did those documents. So I had the documents in place, and we had those discussions when things were calm and things were good.
And have you, I think that's a really important part about, that's a life event, getting married, having kids, moving to a new state. We have these milestones in life, and that's a time to do an activity like advanced care planning by designating healthcare proxy, a will, other legal documents. just like we would for any other health screening, like a mammogram or a colonoscopy at a certain age. That's a recommended thing. So I appreciate you saying that, of like, this was what part of what we did as a milestone in life. Now, since that was as you were having children, and then you've been a caregiver, Gordon had the stroke in 2008, and it's been 13 years and things have changed. Your kids have probably grown up. Have you continued to update the healthcare proxy, or how does that work? How is that the one version? Have things changed, and how are you guys addressing that?
We make it a point to revisit our estate attorney probably once every 5 years. And all the documentation ends up changing. You know, people come and go in your life, and people who were close maybe 5 or 10 years ago maybe aren't as close anymore. Or like in our case, our kids were, 12 and 14 when this happened. Well, now they're in their mid to late 20s. And so who we've assigned as our proxies, who we've assigned as our power of attorney. And it's important to note that you don't just have one person. You have, like, Gordon, my husband, would be my proxy, but after that would be my oldest daughter. And then after that would be my son. So you have this lineup of people because things change and time goes on. So we update ours probably every 5 years. And it's amazing to me how much things really do change in 5 years. You wouldn't think so, but it does.
Right. And a good point about the alternate, should something happen and that first person's not available, they're out of the country, they're incapable for whatever reason, that there is another person as a designated and a third backup person, just in case you need that. So I think those are all valid points. I'm going to go ahead and we've introduced April to the conversation. We're just so appreciative that you are here with us today and that you are a survivor of a cardiac arrest. And I would love to share more about your story. I mean, it sounds really dramatic. You were out there riding your bicycle, had this event. Can you share with us a little bit more about that story and how your journey was, kind of as you had a healthcare proxy step in for you when you were unable to speak on your own behalf?
Sure, thank you. So yes, we were returning, my husband and I, Nick, were returning from a 22-mile bicycle ride, and we were very close to home, fortunately on a busy street. And just to back up just a skosh, we are very physically fit. My husband and I make fitness and nutrition, part of our lifestyle. So I was in, perfect health. So this was a complete shock. So he had already rounded the corner into our neighborhood. So we were less than a mile from the house. And I collapsed with a sudden cardiac arrest. I have zero memory of it. I don't remember the day, actually. I don't recall even, I have memory from noon the day before is the last memory I have. So I don't recall any of this. So I collapsed and a bystander stopped. He's my guardian angel, gave me hands-only CPR. Nick came back to see this. The paramedics arrived. They had to defibrillate me twice, once there on the street and once in the ambulance. Then I was sent to cardiac ICU. They placed 2 stents in my left coronary artery. Things seemed to be stable, but it was a wait and see. And then about 2 hours in, things began to worsen. Things began to fail. Other than my heart, I had a condition called DIC, disseminated intravascular coagulation, where my blood lost its ability to clot. So my blood was actually drowning my body. And it just goes on from there. So having Nick there, thankful he was right by my side. He stayed with me for at least the first 48 hours at the hospital. And it was very clear who my medical proxy was, although it wasn't in writing anywhere, I will admit that, but he was able to insert himself immediately. And without that, I don't know what would have happened. I was basically in a coma for the first 3 weeks. So when I came out of it, Nick told me what happened and I just was in total disbelief, and kind of similar to what Jill said, I can remember, and somehow I communicated because I had been on a ventilator and a feeding tube. So I had no voice. So even when I was awake, I couldn't speak. But somehow I communicated to him that I didn't want to know at all what happened to me. I didn't want to think about that. I only wanted to think about moving forward. So that was the whole plan. He informed all of the nurses, the doctors. No one was to tell me what happened, ask any questions. It was all focused on how to recover. So I think that was, certainly a positive move and kind of set the stage for my future. And there was a situation because of all of that fluid that I was retaining that the doctors had scheduled me for a surgery that was going to open me up from my chest down to my abdomen, but they decided not to have that procedure, but it didn't get fully communicated. And so they actually came into my room and started prepping me, and Nick happened to be there and shut it down. So again, I don't know what would have happened if he wasn't there. There was, because I did have so many different systems fail, I had multiple types of care and rehabilitation. I was on a dialysis machine for 2 weeks for 4 hours a day. Again, I couldn't speak. And then I would come back to my room and be absolutely exhausted. And the physical therapist would walk in 20 minutes later and want me to walk to the door. So there just are these things that have to be communicated, and the caretakers, the physicians and stuff, are doing their job. That is their job. So you must have someone speak for you and help you manage yourself for your best care in the hospital.
Wow. And how long ago did this happen, April? I know it was shortly after your birthday, but did this happen?
2012.
2012.
2012.
Okay,
In April of 2012.
great. Well, we're so grateful that you're here and that you survived, and for, like you said, that your guardian angel who stopped and was able to give you immediate CPR.
Yes.
There's so much to unpack here. So I'm going to start first with you, April. Kind of, you mentioned, building in a healthy lifestyle. You had just turned 50. You're physically fit, eating the good vegetables and fruits that we're supposed to, out exercising. Had you and your husband, Nick, ever had conversations? I know you had said you hadn't had it documented, and you really obviously trust him, and he sounds like he was an amazing advocate and stayed very calm and communicated. But had you had any conversations about your care preferences or wishes, or was it something you hadn't really talked about beforehand?
We hadn't really talked about it. And I know that's because we just felt like we were doing all of the right things.
Mm-hmm.
We
Right.
just felt super healthy. It just, and people that know me, my coworkers, all of my friends, my family were blown away that happened to me.
Right. And I think this, as we were kind of having our prep call, we were talking about that having this discussion and documenting it is for anybody at any age or any stage. And I know, Jill, you were talking about your kids have grown up and, they've gone away to college, and who would be their proxy? Is it the parent? They're no longer a minor. How does that work out? So I think this is a really valid point about it's important to do. And it's hard to do, and it might not be on our top 10 things we want to do with our family members, but it really is important because things can change in a moment's notice.
Absolutely.
And then one other thing I wanted to touch base on, and April, you really hit it when you had said, when you shared the example of Nick being there in the hospital, and the healthcare team was really there doing their job. Nobody was out there intently, trying to overwork you. They're just doing their, I go in here this time, and then after that person, I go in or whatever. But really, Nick was that the communication role that he played. And Jill, I know you can chime in on this too, about saying, as the caregiver, that role of communication, when you're speaking on someone's behalf, of how much detail and how oriented you need to be to all of the different things, not only the loved one you're representing or speaking on behalf of, but yourself, you've got to manage a lot of that. So I don't know if there's anything that either of you wanted to add as it relates to the role and importance of communication in the healthcare proxy position. Jill.
Yeah, so neither of us had ever even been in the hospital before, so we knew nothing. And one thing that was very helpful, my sister-in-law actually handed me a tablet and a pen. And I kept that tablet and pen with me constantly, because it's true, there's this whole team of people working for your loved one. They may or may not be talking, and they're using words I don't even know. So I wrote down everything. And because of all the stress, I couldn't really remember much anyway. I just wrote everything down as quickly as I could, just kind of what was going on, so that I could look back and review it. Because at the time it's, it's like things are bouncing off your head. It's too stressful. So just a pad and a paper, what a difference that made for me.
That's exactly, Nick had a clipboard and a tablet and a pen, and he made it there every single day. I was in the hospital for 2 months. The last 2 weeks were in physical therapy. So every day he was there with that clipboard making the rounds with the doctors, and he would write everything down. And what he couldn't get answered, he's very resourceful. So he was reaching out behind the scenes too and educating himself on what his rights and responsibilities were and how far that could serve taking care of me. So yes, writing things down was absolutely critical.
Absolutely. And then I'm going to close this out with a question around, we talked a little bit about the resiliency, Jill, kind of like just keeping going. And April, you hit on it with, and I really appreciated that focus on recovery, where you weren't interested in knowing the actual event and what had happened. You really wanted to know, let's look forward and that future forward. And I think we've used the words hope, and we've used the words, promising, and kind of, what we wanted to see for the future. And I think that's a really important piece of, as we not only make our plan, but we think about our future and our quality of life and kind of the things that we want in our own life. And that is reflective in the type of care that we would want if we were in a situation, just like you've shared, April. But are there any things that you can add to that about your resiliency, kind of your emotional health, looking forward, in this journey of healthcare? And how you're doing, maybe April, kind of like how you're doing now, years later, with your health, and looking to that kind of that hopeful future.
Well, I think I know myself so well. My husband knows myself so well that recovery, and because physical activity was a part of my life and my lifestyle, that I knew that was important. So for me, we had to focus. And even when I went into physical therapy, I'm outside of the hospital, but now I'm managing my care in physical therapy and trying to communicate that I'm not the person, that can lift a soup can and have that activate the right muscle group or, be effective for me. So, and that once I got my voice back, that was as much of a struggle as not having my voice in the hospital, because that was my care. And I was in control of that once I was out of that hospital setting. I'm not sure if that answers your question, but I didn't have to relearn and become a physical person to recover.
Right.
That
And
was
you could,
part of me.
yeah, you were able to continue to build that up.
Yes, and I had the support system to do that.
Mm-hmm. Jill, anything you want to add to that?
We've done a lot of speaking around the country. We've spoken to a lot of stroke survivors and people who are struggling with various illnesses. And I think my words of advice, one, are set a schedule and set some goals. A lot of people seem to burn out on recovery, because if they aren't working on it, they feel guilty, and pretty soon it takes over their day and they burn out. And so one thing we did early on was we scheduled time. We worked hard for a certain amount of time, and then we always rewarded ourselves. And we set crazy high goals because we had no idea what we were up against. But we set incredibly high goals and we didn't hit a single one, but it got us so much further than if we had just said, well, we'll do this today. You know, we had to have a schedule and we had to have goals, and we celebrated everything that went in the right direction.
That's great. I like that. Set a schedule and set goals. And like you said, you might not get them all, but it helps you continue to move forward and put one foot in front of the other. And every day is a new, new day of recovery. I like that.
And the celebration too. That's
And the
it.
celebration, that's
Yep.
just as
Mhm.
important. Exactly. When you work hard, you get to play hard. Yeah,
Lots
absolutely.
of chocolate, lots of chocolate.
Well, good. I'm glad there was some goodies in there for you. Well, thank you both for sharing your stories with us today. I'd like to now bring Dr. Tavin back on the camera for our question and answer. And I see a couple of folks chatting in the chat box, and really we would like you to continue to put any questions that you have and make sure that you select all panelists and attendees from the drop-down menu so that the AHA group can see those questions and pass them along to me so I can make sure we get them answered. So Dr. Tavin, welcome back. Now that you've heard both Jill and April from the caregiver and patient perspective, is there anything that you want to add from your perspective, or anything that you wanted to chime in on what they may have shared in their stories?
Yes, I think those were wonderful stories. Getting that patient experience is always very helpful. At least even as a physician, just hearing what patients are going through and what caregivers and healthcare proxies have to go through. I often tell patients or I often tell families in the hospital when they're struggling with making those decisions. I tell them it's normal. It's not something you see every day. As a physician, I see it every day, so my experience is very different. But for most families, it's the first time that they've had to deal with a loved one who's critically ill in the hospital, and it is very difficult. I often tell families, especially caregivers that want to stay at the bedside 24/7, I tell them they have to take care of themselves as well. I tell them it's a marathon, it's not a sprint. I'm going to have to rely on them for several days, several weeks. Their family members are the patient has to rely on them once they leave the hospital. And it truly is a marathon and not a sprint. And getting good sleep, getting enough food in your body. I tell them that they can go home, take care of themselves, get some rest, and I'll call them if anything happens. And so I think that's important for caregivers and healthcare proxies to realize that they're going to be they're only as efficient as they are rested and energetic. And as part of the healthcare medical team, I need them to be at 100%, and that means taking care of themselves.
Yeah, I think that's a very important piece. And we've heard, some of you may have heard, caregivers need to put their own oxygen mask on before assisting others with oxygen. Like, you do need to take care of and you make a good point of they become a part of that medical team. And just like we want our physician and our clergy and our social work and our specialists to get their rest and their days off to come back and take care of the patient, we also want the caregiver to take care of themselves. So I think that's a very, very good point to mention. We do have a question from the audience about any advice for resources from proxies to stay up to date or continue to stay educated on how to be the best advocate. And I know we're going to send out some resources after the webinar, but are there things that you, and they don't have to be formal book recommendations or anything, but any advice for resources that you had? I know, Jill, you mentioned that you make a point to update and kind of revisit that every 5 years, but anything else from April or Jill or Dr. Tavin, how people can stay up to date and educated on how to be the best advocate, maybe to pass along?
I would just say, making sure that if you're the advocate for someone else, like me for my husband, we're out for a walk, we're watching TV, the subject will come up, we'll talk about what would you do? What would you want? And just in those calm moments where there's no pressure and you can kind of think out loud together, what would this mean to you? And so I think that's part of being an effective partner, whether it's for healthcare or anything else, is having those conversations and really understanding their wishes, their fears, where their confidences are. It's that calm, quiet moment where you can just talk.
Yeah, this preparing for this made me think, how would my situation have been different if Nick had not been on that ride with me? I mean, just that alone changed things. He could have been, in another country traveling for work or something. So it's not only with that person that you know the best, it is very challenging for the secondary and the third person to be your proxy. It's really mind bending, actually.
Absolutely. Dr. Tavin, anything to add there?
Yes, I would echo all that, everything that's been said. Those are difficult conversations to have. And I've had those conversations with my mother because I'm her medical proxy. And it's not comfortable to talk about life and death and cancer and coma, dementia, life support with someone you love. But it's important to have those discussions ahead of time. Like it's been said, when things are not critical, when you're not under pressure, just having those discussions. So in terms of resources that you can find, I think focusing more on knowing what the patient wants, or who you're going to be representing wants, is probably the most important part of being a healthcare proxy. If I go to a family member and I ask them, what would your father want? And I hear, well, 5 years ago they would have wanted this. I don't know what they want now. It makes it very difficult. If you have questions, you can always go to your treating physician. I mean, we're all trained to discuss those types of situations. Our offices are full of these advanced directives, paperwork that we can actually fill out in person in the office. We have PULSE form, which are physician ordered life-sustaining treatment forms. And so that's a good time to have that discussion if you need some guidance, meaning you want to come in, sit down with your physician, bring your healthcare proxy, and let's just have those discussions together. That's always an option. I actually have office visits that are just about that.
That's great. And that's a great practical tip of that, directing folks to speak with their primary care provider or their specialty care provider. So we're getting ready to wrap up, and I've kind of been taking some notes about some key takeaways. Really, the first one for me is really to begin the process. Don't wait any longer to address it. Start having conversations with people and identifying someone or some alternatives who might be a healthcare proxy. And then I heard loud and clear from Dr. Tavin to really document and get that written down about the preferences, who the person is, who the designated person or person's healthcare proxy, and get it in some sort of advanced directive document so that it is there for people to do. And then keep a copy for myself so it's easily accessible if I need to reference it, and then share copies. Make sure that giving that to family members, friends, the person who I've designated as a healthcare proxy, we don't want them to be out of the loop. Share it with, my specialty providers or my primary care providers. And I'm also hearing about that recovery kind of like, the resiliency and the recovery of looking forward. Should an event happen, I want to make sure the right person is there to step in for me and to work with the care team, and then really to continue to focus on recovery, because we've got some great examples of it here today with Gordon and with April. And Jill is the caregiver, about sharing about how life, happens, and then, life continues on in the next phase. So I appreciate all of you, and I want to thank all of our presenters for the wonderful information and for sharing your personal stories with us today. I'm going to go ahead and turn it back over to Leslie McCall to close us out for today's program.
I just want to say an enormous thank you to Leslie Foran with Regent so much for leading this conversation today on the importance of designating a healthcare proxy. And thank you so much, Dr. Tavin, April, and Jill, for your time and sharing your personal experiences and perspectives today. I think we all learned a lot. We'll be sending a follow-up email with some resources from today's discussion. And on behalf of the American Heart Association and Regents Blue Cross Blue Shield of Oregon, we'd like to thank you for attending. Take care.
Listen, baby.